I think Oshi is the perfect example of a big gap in the industry that was providing multidisciplinary care to patients with chronic GI conditions. Traditionally, the only way these patients could get this kind of care if they went to an academic center. Now, with Oshi, there is a digital solution where using their phone, where a technology that's patient friendly, they have access to this whole spectrum of what you call a GI team. And these are, practicing at the top of their licensure, highly vetted physicians, nurse practitioners, dietitians, and behavior coaches we're all working together. But with technology, it's in the power of your phone. And you could be in any part of the country with any medical, any GI condition, and you could access these resources. So it's honestly like democratization of what initially used to be in the ivory towers, where you can only get this at a certain academic center. So I truly think this is exponential, right? You could be a GI in the community, you see your patient, and you send a digital referral to Oshi, and all of a sudden, a patient in Oregon is seeing a dietitian in New York who specializes in IBS. And I think that is the true power of a digital technology and an exponential technology. It's not governed by time or place or position. It's creating abundance where we have increased access because we're working through employer contracts. So I truly think there's a need. It has become exponential already. It's in 25 states. And it will get to a steady state where I think every GI will see, the promise of this partnership and the fact that all these resources can be available to their patient with a simple referral. So I truly think this is powerful. I also think GI is complex, like Sam alluded to. There are apps and AI, algorithms, but GI is a very complex space just because of the gut-brain axis. And there's a lot of nuances that go into GI. So I do not think a simple algorithm or device, they have value, but I do not think they can provide this wholesome care that a lot of these patients need. And that's where it's hard to have a digital solution that provides that. That's what value I think Oshi has created.